Future doctors, here are some mnemonic for the classification of the antimicrobial agents. So according to their type of action, they are classified in bactericidal agents and bacteriostatic agents. Bactericidal agents, there are some example penicillin, cephalosporin, then fluoroquinolones, then aminoglycosides, rifampicin, and metronidazole. So the trick for this is PC farm. Now next is bacteriostatic agents. So bacteriostatic agents are the one which stops the replication and inhibit the protein synthesis. So here are some examples of bacteriostatic agents. They are clindamycin, then chloramphenicol, damson, then erythromycin, sulfonamides, and tetracyclines. And the mnemonic for this is chased dog. So now second is according to their spectrum of activity. First is narrow spectrum antibiotic, broad spectrum antibiotics. So in narrow spectrum antibiotics, there are two examples, penicillin G and aminoglycosides. You can remember this by the mnemonic NAP. So N for narrow spectrum, then A for aminoglycosides and P for penicillin G. Now next is broad spectrum antibiotics. This can be remembered by broad TC. According to their mechanism of action, drugs that inhibit cell wall synthesis, then drugs that affect cell membrane function, drugs that inhibit protein synthesis, which alter the protein synthesis, as well as inhibit viral DNA synthesis, affect DNA function, and inhibit DNA gyrase, as well as antimetabolites. These are some classes according to which antimicrobial agents are classified. So first is which inhibit the cell wall synthesis. So beta-lactam antibiotics. Here examples are penicillin, cephalosporin, carbapenems, then monobactams. So for this, there is some mnemonic that is people call club members. The next is vancomycin, phosphomycin, acetylcysteine, and cycloserine. Here mnemonic is very fine bacteria clash. The next is which affect the cell membrane function. So here it is polymyxins, then amphotericin B azoles. The next is which inhibit the protein synthesis. Tetracyclines, macrolides, chloramphenicol, clindamycin, linezolid, and aminoglycosides. So here the mnemonic is the mean cyclist can land anywhere. So next is the drugs that alter the protein synthesis by misreading of mRNA code and premature termination of mRNA translation. So here example is aminoglycosides. The next is drugs that inhibit the viral DNA synthesis. Examples are acyclovir and zidovudine. Then drugs that affect the DNA function, rifampicin and rifabutin. The next is antimetabolites. The example are sulfonamide, damson, trimethoprim, then pyrimethamine. So here mnemonic is sulfa, DPT. And the last is drugs that inhibit DNA kinase. An example is FQs, that is fluoroquinolones. So this was all about the classification of the antimicrobial agents.